Hello, let's learn about device associated. Let's see about antimicrobial prophylaxis before we move to the details. The recommendations are for the prevention of surgical site infections, administered within 1 hour of incision to maximize tissue concentration. Once the incision is made, delivery to the wound is impaired. Hence, within 1 hour. The duration of the prophylaxis includes within 24 hours after the procedure, stop the prophylaxis. Within 48 hours of the cardiac surgery, stop the prophylaxis. This is to decrease the selection of antibiotic resistance, to contain the cost, and to limit the adverse events. Excellent surgical technique reduces the risk of surgical site infections. This includes gentle traction and handling of the tissues, effective hemostasis, removal of the tissues, obliteration of the dead spaces, irrigation of the tissues with saline during long procedures, use of fine non-absorbent monofilament suture material, wound closure without tension, adherence to principles of asepsis. Is your operation room is to see whether your operating room is safe. Screening, that is, you are screening for risk factors and presence of MRSA and MSSA. Showers, do you have your patients clean their body the night before and the morning of surgery with chlorhexidine? Skin preparation, are you preparing the skin with alcohol-based antiseptics such as chlorhexidine? Regarding solutions, are you irrigating these issues prior to closure to remove exogenous contaminants? Are you using chlorhexidine? Then regarding sutures, are you using closing tissues with antimicrobial sutures? Skin closure, sealing the incision or covering it with an antimicrobial dressing to prevent exogenous contamination. So regarding surgical practices, antiseptic showers, hair removal, skin preparation solutions, and antibiotic prophylaxis, hand decontaminations, nasal decontaminations, and mechanical bowel preparation. For each of these practices, we have WHO guidelines, CDC guidelines, and NICE guidelines. Accordingly, for as per if you see the WHO guidelines, they suggest advise the patients to shower either with a plain or antimicrobial soap before surgery. But CDC advises to shower with soap before surgery. Nearly the guidelines are nearly the same for WHO CDC NICE for the parameters for prevention of surgical site infections. Regarding glycemic control, wound irrigation, surgical hand gloves, nasal decontamination, maintaining patient hemostasis, gowns, hand decontamination, wound dressing. These are all the surgical practices for the prevention and control of surgical site infections, and we have accordingly the WHO, CDC, and the NICE guideline for the same. Wherein the WHO guideline mentions to suggest use of protocol for intensive blood glucose levels, while CDC suggests blood glucose targets should be less than 200 units. While NICE suggests that do not give insulin routinely to patients who do not have the diabetes. Regarding wound irrigation, WHO guidelines mentions insufficient evidences to recommend for or against saline irrigation. Use aqueous providing iodine solution before closure. While the CDC guidelines mentions consider intraoperative irrigation of deep or subcutaneous tissues with aqueous iodine for solutions. Do not, while NICE says do not use the wound irrigations. So regarding changing the dressings and topical antimicrobial agents for wound healing by primary intentions, dressings for the wound healing by secondary intention, and debridement and special wound care services. WHO guideline mentions perioperative antibiotic prophylaxis should not be continued in the presence of wound drain. Don't use any type of advanced dressings. As CDC mentioned, do not apply local or antimicrobial agents to the surgical incision. NICE mentions use an aseptic non-touch technique. Do not use topical antifungal agents, antimicrobial agents. Do not use USL and gauze or moist cotton gauze for mercuric antiseptic solution. These are the formulas for calculating the Cauchy rate, VAP rate, CLAPS rate, and SSI rate. For example, for SSI rate is the number of SSI for a location upon the number of surgeries in 2000. For CLAPS it is the number of CLAPS upon the number of central line days. Caution is an action of the past, except when hands are visibly soiled, recognized, explained, and acts called based hand job. Five components of the World Hand Hygiene Strategy include system change, that is alcohol-based hand at the point of care, access to continuous water supply and towels, training and education. Then third is observation feedback. Four is the reminders in the hospital, and fifth is hospital safety. The five members of hand hygiene should be seen, and a multidisciplinary team approach should be involved for the inpatient. Where are we going? Recognize, explain, act through a team approach at a state level, at the international level, and financial bodies. And for the patients of the promotions, healthcare systems, hospitals. A multimodal strategy will include system change, education, monitoring performance, and feedback, and reminders and safety.